Hello everyone and welcome back to my YouTube channel. In today's video, I'm going to talk about a very serious health condition. So yes, I'm talking about amnesia. Amnesia, which is characterized by partial or complete memory loss and can result from various causes such as trauma, illness, or psychological factors. You or someone you know is suffering from amnesia. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. So today we will explore how homeopathic treatment offers a gentle and holistic approach to addressing amnesia and supporting the restoration of the memories. So before we delve into the homeopathic treatment, let's take a moment to understand what exactly is the meaning of amnesia. So let's talk about it. So, amnesia refers to the loss of the memories, including facts, informations, and the experiences. Movies and televisions tend to depict amnesia as forgetting your identity, but that's not generally in the case in real life. Okay, so instead people with the amnesia also call amnesic syndrome, and usually they know who they are, but they may have troubles learning new information and forming new memories. So, amnesia can be caused by damage to the areas of the brain that are vital for memory processing. Unlike a temporary episodes of memory loss called transient global amnesia, amnesia can be permanent. So, this is the exact meaning of amnesia. I hope this is clear to you. Now, next we'll talk about the clinical features of amnesia. So the two main features of amnesia are first is trouble learning new information and second is trouble remembering the past events and previously familiar information. So most people with amnesia have the problems with the short-term memory, so they cannot retain new information. Recent memories are most likely to be lost, more remote or the deeply ingrained memories may be spread. For example, people may recall experiences from childhood or know the names of the past, but they may not be able to name the current president, know the month, or remember what they ate for breakfast. So, isolating memories loss doesn't affect a person's intelligence and general knowledge and awareness or the attention span. It also doesn't affect judgment, personality, or identity. So, people with amnesia usually can understand written and spoken words and can learn skills such as bike riding or piano playing. They may understand they have a memory disorder. And amnesia is not the same as dementia. Dementia often include memory loss, but also involve other problems with thinking that leads to a decline in the daily functioning. These problems include having trouble with the language, judgment, and visual spatial skills. So I hope you understand the difference between the amnesia and dementia. So memory loss is also a common symptom of mild cognitive impairment, and this disorder involves memory and other cognitive problems that are not as severe as those experienced in dementia. So, additionally, another symptoms can be false memories that are either completely invented or are real memories misplaced in time or confusions or disorientation. Now, next we'll talk about the various types of amnesia. So basically, there are six type of amnesia. One by one, I will be talking about all these types in an elaborated manner. So first type of amnesia is anterograde amnesia. So, in this type of amnesia, a person cannot learn, remember new information, or is unable to form new memories, but the remembers previous memories before the event. This mostly arises from too much alcohol, brain damage, from trauma, injuries to the brain, stroke, and encephalitis. And this type of amnesia can be temporary or permanent, so depending on the cause behind it. Second type of amnesia is retrograde amnesia. So, in this type of amnesia, people have difficulty in remembering the past events, informations, and have inability to recall the previous memories. Third type is transient global amnesia. So, in this type of amnesia, a person experiences confusion or agitation that appears on and off for several hours. The person also loses memory of event in the hours before the attack. Symptoms mostly last for less than a day in this type, and it is thought to occur from seizures or blockage of the blood vessels which are supplying the brain for a short period of time. And it is a very rare type and is most commonly seen in middle-aged and older adults. Now, fourth type of amnesia is childhood or infantile amnesia. So, in this type of amnesia, the person is unable to recall events from one's early childhood and from 3 to 5 years of age. This may be due to problems with the language development or incomplete maturing of certain areas of the brain that are linked with the memory. Now, next type is post traumatic amnesia. So, this type of amnesia arises from head injury, trauma, like from a hard blow to the head. It is mostly temporary for a short time, but may be permanent also. But it depends upon the severity of the injury. Now, last type of amnesia is psychogenic amnesia. So, it is a very rare type of amnesia and arises from emotional shock, like from being a victim or any violent crime, etc. Okay, so this is a broad classification of amnesia. So next we'll talk about when to see a doctor. So anyone who experiences unexplained memory loss, head injury, or confusion requires immediate medical attention. So people with amnesia may not know where they are or be able to seek medical care. So if someone you know has symptoms of amnesia, so help the person get medical attention. Now, next we'll talk about the etiology, that is, what are the potential causes which are responsible for amnesia. So, typical memory functions involve many parts of the brain, and any disease or injury that affects the brain can affect the memory. Amnesia can result from damage to the brain structures that forms the limbic system, which controls the emotions and the memories. They include the thalamus, which is found deep within the center of the brain. They also include the hippocampal formations found within the temporal lobes of the brain. So, amnesia can be caused by brain injury or damage, which is also known as neurological amnesia. And the potential causes of neurological amnesia include stroke, brain inflammation, which may be due to an infection with a virus such as herpes simplex virus, or inflammation may be result of an autoimmune reaction to the cancer somewhere in the body. It also may be due to an autoimmune reaction in the absence of a cancer, and the next cause can be not getting enough oxygen to the brain. Next is long term alcohol misuse, which to too little vitamin B1, which is known as thiamine in the body. And when this happens, it is also called as Wernicke-Korsakoff syndrome. And tumors in the areas of the brain that controls memory can be the potential cause. Next cause is seizures, and another cause is Alzheimer's disease. And certain medications such as sedatives, they can be the potential causes responsible for amnesia. The next we'll talk about the risk factors. So, the chances of developing amnesia might increase if you have experienced brain surgery, head injury or trauma, stroke, alcohol abuse, seizures, etc. Next, what are the complications? So, amnesia varies in severity and scope, but even mild amnesia takes a toll on daily activities and the quality of life. The syndrome can cause problems at work, at school, and in social settings. It may not be possible to recover lost memories, and some people with severe memory problems need to be supervised or need to live in a care faculty or facility. Next, we'll talk about the investigations of amnesia. So, how to diagnose it. So, let's talk about the diagnosis and investigation criteria. So, a comprehensive evaluation is needed for diagnosing amnesia. It can rule out other possible causes of memory loss, such as Alzheimer's disease and other forms of dementia, depression, or a brain tumor. So, first, what we do is to take the medical history, then physical examination, then other investigations. So, first, we'll talk about the medical history. The evaluation start with a detailed medical history because a person with memory loss not be able to provide thorough information. A family member or a friend or another caregiver usually provide information. So, your healthcare provider can ask you several questions to help understand the memory loss. And issues that might be addressed include the type of memory loss, whether it's recent or long term. Second, when the memory problem started and how they progressed. Next, they can ask factors that triggered memory problems, such as head injury, stroke, or surgery. Next, they can ask family history, especially of the neurological disease, drug and alcohol uses, history of seizures, headache, depression, and the cancer. Okay. Next is physical examination. So the physical examination may include a neurological examination to check the reflexes, sensory functions, and the balance. And there are another several tests for the amnesia, and the first is cognitive test. Now, what is cognitive test? So the exam typically include tests related to thinking, judgment, and recent and the long-term memory. You will be asked about your knowledge of general information such as the name of the current person, as well as personal information and past events. You may be asked to repeat a list of words. The memory evaluation can help determine the extent of the memory loss and provide insights about what kind of help you may need. Next is a diagnostic test. So your healthcare provider can also order some tests like imaging tests like MRI and CT scan to check the brain damage, and blood test to check for the infection, nutritional deficiencies, and other issues. And last test is EEG, that is electroencephalogram, to check the presence of the seizure activity. So these are the various tests which can be performed in order to diagnose amnesia. Next, we'll talk about the treatment. So, what is the ultimate treatment for amnesia? So, yes, we are talking about the homeopathic treatment and homeopathic medicines which can be used for the treatment of amnesia. So, let's talk about homeopathic treatment for amnesia. So, homeopathic medicines play a very effective role in managing cases of amnesia. These medicines aim to halt the further progression of the condition, and depending upon the case recovery, how much recovery is possible with them depend upon the severity of the condition as well as the reason behind it. So, one can use these medicines along with psychotherapy to help a person as much as possible. So, first medicine that you can see here on the screen is anacardium. So it is very beneficial homeopathic medicine when there is a marked loss of memory. The person eating it does not retain anything in his memory. He loses power of recollection completely. It may happen all of a sudden, and it is well indicated for memory loss after stroke and after some sort of fright. And, and it is also a top grade medicine to manage amnesia in Alzheimer's disease. Next medicine is cicuta. So, secuta is well indicated when a person fails to recognize anybody and is unable to remember what has happened recently. His memory goes blank for hours or day together. To him, everything appears strange. He is confused and mixes up the present with the past. It is a very useful homeopathic medicine with the memory loss follows seizures. Next medicine is Nux moschata. So, it is given when there is loss of memory and a person does not recognize surrounding places and streets previously which were well known to him. He seems to be lost somewhere when spoken to. He gives answers which have no reference to the questions asked to him. While speaking, he is unable to use appropriate word and stop many a time in between the lines and changes the speech because of his inability to use right and accurate words. It is also indicated when there is entire loss of the memory of his past life. Next medicine for amnesia is alumina. This is the next helpful medicine for the loss of memory, and person needing it are unable to recollect things. They have great confusion of mind. They make mistakes in speaking and writing, and while speaking, they use words which are not to be used, and they also are incapable of following up an idea. Next medicine for amnesia is Agathis americana. This medicine is prepared from kauri tree, and it is a great medicine to manage cases of memory loss. People who need it retain memories for the past events but are forgetful for everyday things. They are also very forgetful for words and mixes of words and use wrong letters. Forgetfulness about what they were about to do and say may also be there. Next medicine is Absinthium artemisia. This medicine is prepared from fresh young leaves and the flowers of a plant which is commonly known as common wormwoods. This medicine is mainly recommended for the cases where memory loss arises after epilepsy or epileptic fit. It is also indicated where there is forgetfulness about what has recently happened before and after fit. Now, the last medicine for amnesia is cannabis indica. So, this medicine is mostly used when there is a sudden loss of memory and have a poor short term memory. There is a complete forgetfulness about recent thoughts, speech, ideas, and action. So, these are some homeopathic medicines which can be used for the treatment of amnesia. So, that's all. So, in conclusion, I want to say that homeopathic treatment for amnesia should always be integrated with conventional medical care, and it offers a gentle and holistic approach to addressing the underlying causes of memory loss and supporting mental and emotional well being. So, if you or someone you know is struggling with amnesia, I encourage you to consult right now. So, together we can work toward restoring memories and reclaiming a sense of one wholeness and vitality and oneness. So, thank you so much for watching, and until next time, take care and stay well. So, that's all for today. See you guys in the next video. Till then, stay safe and stay healthy. So if you find this video informative, helpful, and especially valuable, so please give this video a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. And if you are suffering from any of the health issues or you are suffering from amnesia, you can contact us for online appointments. On the screen, you can see how to contact us. So that's it for now, and thanks for watching this video.